Hello, everyone. Good morning, good afternoon, good evening, depending on where you're joining from. Welcome to International Medical Corps' update on our response in Ukraine. I'm Rebecca Milner, Chief Advancement Officer here at International Medical Corps. We're delighted that you've all taken time out of your busy schedules to join us today. Many of you on the call have generously supported our work over the years, and in particular, supported our response in Ukraine. And we're incredibly grateful to you for your trust and your commitment to our work. And in fact, we couldn't do it without you. Your support makes our work possible. So thank you. Thank you very much. We're going to keep today's briefing as efficient as possible. We promise to wrap up in about 45 minutes. Towards the end of our conversation, we will take questions from the chat. So as we talk, please feel free to type in your questions and we'll do our best to get to them. As you know, International Medical Corps has a long history in Ukraine. We started work in 1999 and have had a continuous presence there since 2014, when Russia annexed Crimea. We had a small team of about 30 working and living in Mariupol, providing health and mental health support alongside one of our local partners. Of course, all of that changed dramatically on February 24th, when Russia invaded Ukraine. Over the past 3 months, we've had to adapt and rapidly scale up our services to meet the growing needs. We quickly moved our base of operations from Mariupol to Kyiv and then to Lviv in the early days of the conflict, always remaining flexible to meet the demands of the ever-changing reality on the ground, while doing what we could to keep our teams as safe as possible. It's been a challenging 3 months. However, our colleagues have accomplished an incredible amount of work during that time. To date, we've been supporting 33 health facilities and 17 reception centers for internally displaced people throughout the country. We've delivered more than 200 tons of medicine, supplies, and equipment, trained hundreds of healthcare workers and first responders on psychological first aid and trauma care. And we're working with the Ministry of Health and local health authorities to continue to expand our services to support and rebuild the health system. All of our efforts are geared toward ensuring continuity of health services across the country based on needs, feasibility, access, and security. To give us a picture of what our teams are facing on the ground, we have our Chief Operating Officer, Ki Liu, joining us today. Ki has decades of experience in the humanitarian field, including serving as head of USAID's Office of Foreign Disaster Assistance under the George W. Bush administration. So he has lots of experience working in these kinds of contexts. He leads our global programs and oversees our Ukraine response. Ki's just returned last night from 2 weeks in Ukraine, traveling throughout the country. We're looking forward to hearing his reflections on this visit. Thank you for joining us, Ki. Why don't you tell us a little bit about your visit and where you went? Maybe we could have him on video? There he is. Okay.
Hi, everyone. Yes, so I will start off by reinforcing Rebecca's message and really thanking everybody on the call today. Your support, the funding that you provide us allows us to move quickly. And the situation in Ukraine is fluid. The front lines are changing on a daily, weekly basis. And those private resources allows us to be able, when we sit down with local authorities, when we see the conditions changing and evolving, to move quickly to be able to procure, to bring in people. So as Rebecca pointed out, yes, over the last 3 months, a tremendous amount of work has been done, but that's just the foundation that we are building in Ukraine. And I did have an opportunity over the last 2 weeks to travel pretty much throughout the country. We arrived, and the way to get into Ukraine, you have to cross over the border in Poland. So you arrive at a border town called Rezhov. And then from there, it's about a 5-hour crossing to get into Lviv, which is where we had temporarily moved our base of operations from Mariupol to Kyiv to Lviv. And the situation in Lviv is quite normal if you didn't understand or hadn't watching the news for the last 3 months. It's a beautiful city, but it is host to a large amount of IDPs. And therefore our teams have been there, but they're moving now. They're moving into the most vulnerable impacted areas. So after spending a night in Lviv, in western part of Ukraine, we moved to Vinnytsia, which is the central portion of Ukraine. That's about a 9-hour drive towards the center from Lviv. This is where we will be providing our administrative base of operations. It is a relatively safe and secure area, though everybody in Ukraine is affected by the air sirens, by the air missiles. And at any given time, that threat is real. So in Lviv, just about 2.5 weeks before my arrival, our office was located in the central portion of Lviv. And there was a large missile strike that took out the railroad station. And you could see the damage and feel the impact up front from our offices. So our staff had been working in hotels. We're going to be moving into Vinnytsia. From Vinnytsia, we then went down to Odessa down in the south. And you've probably been seeing the reports here. Odessa is a beautiful city. And it is right on the front lines. And you'll see on the map there that the Russian forces are right next door in an area called Mykolaiv. Odessa has been hit with airstrikes repeatedly. When I was out there, we had a meeting with the governor. In the middle of our meeting, the air sirens go off. Of course, we all looked at each other and continued with the meeting. It was important. The governor told us that he was required to shelter in place, but he didn't. And he stayed with us for an hour and a half, and we worked out the details. From Odessa, then we drove up north to Kyiv and also to Chernihiv. And Kyiv, is, again, just a beautiful town. People are returning back. But when you go 3.5 hours outside of Kyiv to Chernihiv, which is right in the border with Russia and Belarus, you will see the damage there. So I was able to spend time, from the western portion of the country, going to the central portion of the country, down to the south, up to the north. We didn't make it into the east, but we currently do have an emergency response team that is in Dnipro and is providing and looking at ways to be able to support the internally displaced persons that are coming from the Donbass. So it was quite a trip over the last 2 weeks.
Right. And I mean, as you were talking about it, you were talking about how the West is relatively untouched. The North and the central part is sort of depends. And then on the East, it's where the active conflict is. What are some of the things that each of those communities are facing? Like, how are they coping and how are they handling the active conflict?
So in the West, as I mentioned in Lviv, where there's been a large amount of IDPs that have gathered within there because it's relatively stable. If you were just, as I said, to spend a day or an afternoon there, you would not believe that the country was at war. However, as I said, you're getting a large amount of displaced population from the East and from the South that are in Lviv. You can't escape the sirens, they're there. And as much as the people in Lviv and in the west portion of the country are getting back to a sense of normalcy, all it takes is one missile strike to be able to change that perception of being safe. But it is something where you compare that to what we're seeing in the East, where there's active conflict. In the South, in Odessa, people recognize that they're preparing for the worst case scenario. The plan is, we believe, for the Russians to try to overtake Odessa. That will cut off all access and routes to the sea. That is a priority for them. They've already taken Mariupol. Mariupol was our former base of operations. As we were scaling up and are scaling up, over the last 3 months, we still had 26 people trapped in Mariupol. It went down to 20, went down to 19. To date, we've been very fortunate. We have heard from all of our staff but one. And I would say about half of our staff are back at work. And the others are looking at relocating and coming back and work for the International Medical Corps. They are dedicated to our mission. We're dedicated to supporting them. So in Odessa, there is this very strong sense that they're on the front lines. You wouldn't believe it when you're walking around the city, but you see that in terms of the number of military checkpoints. You see that in the number of sirens that are going off. And in discussions that we're having with local authorities, that's what we're doing. We're looking at ways to be able to prepare them for the influx of displaced persons, prepare them for continuity of care. Then you go up to where we were in Chernihiv, which I mentioned was in the early days. This is where the Russians came in from both Belarus and from Russia. They occupied Chernihiv. And up until this point, I had not seen damage. And you saw that in Chernihiv, where the building, the targeting of the civilian population, of hospitals, of schools, it was quite devastating. And I saw that first up front. You'll see here on the left-hand side, this is the referral hospital in Chernihiv. And they took a direct missile strike there. And we saw that time and time again with the damage that was taking place. The picture on the right-hand side is from Boryanka, which is, I would say, about 45 minutes south of Kyiv. So this is what we're talking about, where when you look at Kyiv or Odessa or Lviv, it seems like it's normal. People want to get back to their lives. And yet you can hear the missiles, you can hear the strikes, you can hear the landmines that they're trying to clear. And the level of devastation is there. So you drive from town to town, you see that. So that's what's happening. And I think that this is where we have access. This is just where I was able to travel to. But when we look at what's happening in Kharkiv, when we're looking at the devastation that we've seen pictures of in Mariupol and elsewhere in the East, we're bracing ourselves for the worst. And the worst is yet to come, unfortunately.
Right. Well, and it seems like it's sort of the conflict itself and the impact on civilians is sort of having different phases, right? So initially we saw millions of people leave the country, right? And we know there are millions of people inside the country that have been displaced. I mean, what kinds of, how is Ukraine dealing with that enormous sense of displacement? I mean, are people still on the move, or are they kind of settled in, hunkering down? What's that like? So
the numbers are tremendous in terms of scale and scope. If you look at it, I think it's been reported to be as high as 15 million people displaced, 6 million refugees in neighboring countries, and 9 to 10 million internally displaced. People are just constantly moving. Now, in the early days, we saw numbers. I mean, this is where from the Polish border, and we initially and continue to have a presence in Poland. We are supporting mobile health units along the border. We're supporting the local authorities in their refugee centers to be able to deal with the influx of refugees. Poland, I believe, is host to somewhere thing like 2 to 3 million refugees. And you put that in the context of the US and the population, that's like 20, 25 million refugees coming in the United States within a 3-week period. So at the border area, we saw this. While I was there, when I was coming in, it was the reverse. You did see on the Ukrainian side, mainly, only women are able to cross at this stage, but they were not crossing to seek asylum or to refugee status. They were crossing to shop. And you saw them coming in with their empty bags, and they would go and shop and they would bring back supplies. The same thing, I saw convoys of vehicles on both sides entering into Ukraine and entering out of trucks. You're talking about 11 kilometers of trucks that are lined up. And people are returning because they're recognizing that in spite of the conflict, the Ukrainian people want to return back. And we hear that from the local authorities. We hear that from people who are returning. They may be displaced inside Ukraine, but they see this as an opportunity where they're not going to go. And I think it's a tremendous opportunity for us at the International Medical Corps to support them in this effort. And as I said, it may look as if in areas like Lviv that are safe, any other European city, and yet I think it's not just the infrastructure or perhaps the critical care, but one of the areas that I will explain a little bit further are some of the activities that we're carrying out. And addressing mental health at all levels is critical. And it's one of those things where my last day we had to come back out of Lviv. Yes, we're sitting there in a cafe and we're having a coffee. A siren goes off, and you can see it where people kind of stop for a moment. They go on, but it's there in the background. And therefore, there is just so much to do, especially not only in terms of trauma and reconstruction activities, but addressing both that short-term acute mental health and looking at ways to sustain these efforts over time. I think that's much needed. So yes, people are coming back, they're displaced, but I do think that there's a real opportunity to hire locally, to be able to support local Ukrainian organizations, to build their capacity to work in partnership with it, to be able to deliver assistance.
Right. I mean, as you were meeting with local health authorities across the country, I mean, was there any particular conversation that really stuck with you? I mean, that sort of, symbolizes the kind of challenges that the Ukrainian government's facing? Yeah.
So the two of the pictures that you saw, the picture on the left that had the referral hospital. This is a hospital that's can have up to 600 patients, and it took a direct hit. Now in Chernihiv, we also visited the TB hospital, and this is a TB hospital that under the former Soviet Union, it was the second largest TB facility in all of the former Soviet Union. Chernihiv was invaded and it was occupied for 6 weeks. The TB hospital was entirely damaged. And Ukraine has the fourth highest caseload in all of Eastern Europe. And it is one of the worst in terms of multi-drug resistant TB. So where are these people? Where are the patients? They're being taken care of in the infectious disease unit within the children's hospital. They're on the move. They're in temporary care shelters. Those who are under clinical care may not have access to the medicines. And so therefore, from just an infection prevention control measure, this is what's happening countrywide with regard to these TB hospitals. So we heard these stories. We are working with the local authorities in Chernihiv to rebuild this hospital. In 3 months' time, we hope that our contractors are going to be able to find a new site to support the local authorities to be able to provide that critical care. But that's just one critical facility that we're supporting. We also met with the psychiatric hospital that was maybe about 4 kilometers from that referral hospital. And we met with the hospital administrator and 2 of their clinical doctors. They housed prior to the conflict, about 330 patients. And as the Russians came in, they bombed the facility, they cut off the water, they cut off the generators. It was 7 degrees below zero outside. The clinical staff, some of them evacuated, but most of them stayed. And they were able to evacuate the patients for about 300 of them, but about 60 of these patients could not be moved. And therefore, they moved them down to the basement of the hospital. And for the next 5 weeks, they went without water. They had to go outside to risk their lives to be able to find a well. They were being shelled. There was no heat. They had to cook outside underneath shelter. They were afraid that if the Russians saw that there was a lot of lights or fire, that they could be further targeted, looking at as a military institution. As a result of the conditions, 33 of those patients that were under the basement died. And the hospital administrator told me that for 2 weeks, they could not bury the bodies. And because they were getting shot at, they couldn't leave the hospital. So if you can imagine the conditions in a psychiatric hospital with the most vulnerable population under those conditions, and they had 2 bodies that were deteriorating. This is what they're grappling with, and yet they're back. We walked around the facility. They have now taken the patients back. They're talking about the future. And of course, this is a story that they've told over and over and over again. But this is where and how resilient this group of clinicians and frontline actors are. And this is what I think inspires us to continue to do this. Another incredible story was that in Bucha, and if you saw the stories there, this is where the mass graves were. International Medical Corps was actually the first international organization invited by the government. We were part of the initial delegation that came in on April 8th. And at that time, I was able to receive pictures back from our emergency response team. We saw the mass graves. We saw the open pits. We saw the bodies there. And I went to Bucha to go around and the pictures were devastating. And we met with the regional director for Bucha, and her facility is right across the street from the church where the mass graves were. So outside her window, you can see the church. And we sat down, and she was very quiet initially, very welcoming, just very receptive, very thankful. But it was only when I asked her, I said, tell me your story. What were you here? What did you go through? And she said, yes, she was there when the Russians came into Bucha. She was arrested. They tried to keep all of the clinical staff there to be able to provide care for the military. She was able to escape along with her husband to Irpin, which is next door, which was even worse because the Russians occupied Bucha, but they were trying to overtake Irpin. So in Irpin, which is where all the shelling took place, so about half of the town, if you look at the facilities, aren't even there. And she just kind of, after she told her story, kind of broke down and looked at all of us in the room. And we had our deputy country director, we had our head of the medical team there, our field team, our medical coordinator, and she asked this question, which I was a little surprised, but she said, "We're so thankful you're here, but why are you doing this? I mean, why is your organization?" And she knew about what we were doing, in Yemen. She knew about what we were doing in Syria. She's like, "Why do you do this? And how can you do this?" And we kind of pointed out in the room, I said, if you look at our deputy country director, he's from Croatia. He and his family went through a conflict. If you look at our medical coordinator, we pulled her from our program in Venezuela. If you look at our head of our emergency response team, he's from Pakistan. I told her I'm a refugee from Vietnam. And I said, this is why we're here, because we and our families and our communities have been caught up by this conflict, and people came in and helped us. Organizations like the International Medical Corps were there. And therefore, this is what this organization does. It brings in people who have these experiences, have survived them, have recovered, and then we want to be able to take this experience and come back. So I think it was quite powerful to see that how quickly these Ukrainian clinical staff have returned, but you can tell that it's still fresh. It was 3 weeks ago that she came back to work. And in her office, they're still sweeping away the glass. They're still putting up the plastic sheeting. and yet they're seeing patients. And when you see that, when you hear these stories, you can't but want to do more.
But be motivated to help,
Yeah.
right? Absolutely, absolutely. Well, let's talk a little bit about our strategy moving forward, and sort of our plans, both on the health, the mental health, WASH side, all of the different components of our response.
So we've taken a whole of country approach where dealing with the immediate conflict right now. So you'll see in this map with the red area in the east, this is where the Russians have either currently have occupied, or these are frontline areas. And the plan to deal with the Donbass, whether it's people coming out of Mariupol or the Donetsk or in Kharkiv, is that we have set up operations in an area called Dnipro. And we also have programs in Kharkiv where we're supporting reception centers that will provide trauma and healthcare, mental health services. In Kharkiv, we are working to restore their blood bank. And in a conflict zone, that is probably the most critical thing that you can do. And this blood bank is not only supporting Kharkiv, but it's supporting the whole region as a whole. We have just provided ambulances to Kharkiv, and we're supporting their EMS to be able to strengthen that. So in either areas that are under conflict dealing with displaced populations, it's providing that critical health trauma care, whether it's through ambulatory services, mobile health clinics, providing reception centers to house, to care, to clothe, to provide food and shelter and cash assistance to allow the displaced population to also take care of their families. But in areas like in Chernihiv that I told you about, or Irpin and Bucha, where this is where I told you the story of Oksana. This is where the facilities are devastated. This is where the TB facility is non-functional. What do we do to be able to restore physically the facility in order for operations to continue? But we also have to supply them with the essential medicines and supplies and equipment over time, and also to ensure that there is sufficient staff to be able to provide that critical care. So in areas that are new, let's say liberated areas, Chernihiv, Irpin, Bucha, and Kyiv, it's health, it's water sanitation, it's the rehabilitation physically, and also throughout all of our programs, it's mental health at all levels. And even in Lviv, where I mentioned that it's relatively safe, there's still a great need in terms of mental health activities, as well as providing cash assistance for that displaced population. The economy is in ruins. So as much as we see people coming back, it's not as if investments are taking place. So what do we do with this population? How do we find them housing there? In areas that are bracing themselves for further attack, like Odessa. This is where 4 hospitals in Odessa, we are helping them to be able to harden the facility. We're putting in ICU in the basement so that every time there is an air missile and a siren that goes off, what's happening now is that they have to leave their patients. They can't move them. So they're having to move from the 6th floor to the 8th floor down to the basement for 2-3 hours at a time. So what we're doing in these facilities is to be able to harden them, to be able to provide them with infection prevention and control measures and the equipment so that those critical patients can be moved down to the basement into the bunkers so that they are there, that continuity care takes place. We're also dealing with displaced populations in Odessa. There's 30,000 people that are displaced there. And we expect more that are coming in from Malachi, which is right next door. So Odessa and Kharkiv are areas where they are hardening the facility. They're on the front lines, and they're also now looking at large amounts of displaced persons coming in. So this really is a whole of Ukraine activity, where, as you can see in the map here, we have not only established mobile teams, we have now programmatic hubs. Each one of these hubs now has logistics, procurement, finance, technical teams. We have our water sanitation expert. We have our mental health expert. We have our gender-based violence. We have our health teams there that are working with local authorities in real time to identify whatever it is that is needed to be done. We have to move quickly. And that's the requirement here. And I think this is really where, for our institutional or private donors, your resources allows us, when we sit across the table. So for example, our initial activity in Odessa was just really to look at hardening the 4 hospitals, those facilities, in terms of providing for the glass, improving the bunker up there. But then we explained to them in Kharkiv, we just donated 13 ambulances and we're working with the EMS. They said, that's what we need. We need that right now. We need to connect our central health system to the rural areas. We said, we can do this for you. Then they said, we also are in great need of water. We have all of these boreholes that we've identified, but we don't have the engineers to go out there. And we said, well, we can do this for you. We can send in our experts tomorrow. And this is when the governor and his cabinet looked at us and just said, you've got to be kidding me. You can do this for us now? And I said, yes, this is what the International Medical Corps can do. So this is how quickly our teams are moving from it within the last 3 months. We have moved, if you think about the scale and scope, from an office that was in Mariupol with 30 staff, we're going to be at about 450 staff, I would say, within the next 2 to 3 weeks. Right. And you can look at all those programmatic hubs now with all of those functions in there. It's just an incredible credit to what our teams are doing. And I'm really proud of our staff at the field level and all of our HQ staff that are working day and night to be able to support.
Right. Well, we do have one question from one of our guests that is asking if we have our own clinical staff on the front lines.
Yes. So from a clinical side, right there, we are bringing in clinicians to be able to build capacity. Mm-hmm. So there are still major gaps in terms of trauma, in terms of EMS, in terms of other aspects of providing clinical critical care, where our clinicians are not necessarily providing the direct service delivery, but they're working with our clinicians. And I think that on the training and the capacity aspect here, there are great gaps, for example, on chemical, biological, nuclear warfare. Some of these areas in Chernihiv, we believe there were chemical and biological activities that were taking place. We were warned not to go into certain areas. And it's only been about 2 or 3 weeks. And where the Russians have invaded, there are landmines everywhere. So while you are driving through, you hear the air sirens, but you also are hearing the background where they're trying to clear the landmines. Right. So access is still an issue here in terms of, as people are returning, there are limited shelter for them. And also in the rural areas, it is very, very dangerous to move around. Mm-hmm. So our clinicians, yes, they're a part of our team, but we have a large technical team that's on the ground. Right. So the numbers of mental health advisors, the numbers of water and sanitation advisors that are there, that's where we are directly implementing. And that is an area here where I think that, yes, trauma is going to be needed, supporting the EMS structure, but mental health. And we are getting support from the First Lady. We're getting support at all levels, where at a national level, we're leading a whole sensitization campaign for 30-second, 1-minute sound bites for Ukrainian officials and leaders to talk. It's okay.
Right. It's okay break down the stigma.
Yeah, it's okay to seek help. Right. But then we're integrating psychosocial services at the primary healthcare level. And this is where 80% of Ukrainians access healthcare. So at that primary healthcare level, for the first time ever in Ukraine, we will be having psychosocial services, that element there. And then we're tying that into the existing referral network that's in place within Ukraine. So what we don't want to do is create something outside. We want to expand, we want to strengthen, we want to connect. And I think that on the mental health and psychosocial service, that's where we're directly implementing, we're directly supporting. And I think that we have a tremendous opportunity here in terms of being able to deal with the short and acute phase. But it's that longer term, what do we do when they're continuously faced with conflict setting, with airstrikes, and there is no end in sight. So as much as I think right now people are returning, they're trying to feel normal, but at some point in time, I think that initial kind of we're home is going to fade away, and they're going to be faced with the reality. And with that, what do we do next?
Right. Well, and you make an important point about really not being careful not to set up a parallel system and ensuring that we're bolstering and supporting what exists. I mean, one of the questions from one of our guests is about how do we identify and partner with local organizations, whether they're, I guess, part of the government side or whether they're private, nonprofit side.
All of the above, all of the above. So, for example, when our teams go into Kharkiv or into Dnipro, we initially go in with a security team and a logistics team that will look at, okay, are the routes safe? How do we bring our teams in and out? Where they're going to stay? We introduce ourselves to local authorities, and then the program team comes in after that. And that program team will sit down with the local health authorities. They'll talk to Ministry of Interior. We want to know where the displaced population is. We'll go to those centers. We'll talk to them about what their needs are. Then we'll ask around, who's doing what? What organizations are delivering food? Who is delivering water? Who's providing clothing? And we want to sit down with those organizations. And what we're doing is we have set up a mechanism where we're providing immediate cash assistance to those local organizations. We don't want to come in and in any way push out these local actors. They know they have the inroads, but we can scale them up. We can help them with their systems. We can help them with their procurement. And that's how we do our work. This is really where, first and foremost, we have to ensure the safety and security of our staff. But then once we're able to do that, it's driven by the local authorities. It's driven by the people who are affected. They tell us what they need to do, what we need to do, whether it's health, like I said, it could be water sanitation, and cash assistance. I mean, ensuring that vulnerable families right now, pregnant and lactating mothers, those households are receiving not only aid, but they're receiving cash to empower them to be able to do what is necessary with their families.
Right. I mean, I think one of the interesting things about the people that have been most affected by this conflict in Ukraine is the age group that the population that's been affected is older, and it's unusual in a country like in a country in conflict where the people in need are the older people. And you were kind of talking about Ukrainians on the move, but you were talking about those of a certain age. If they couldn't move, they were stuck, right?
Yeah. So, yes, I mean, we see this in any context, that first wave of refugees or the first wave, I mean, these are the people with resources. They have the ability to get out of harm's way.
Right.
What's happening in the Donbass right now, the people who are left behind in Mariupol, these are family members who maybe the father or the mother, is bedridden, and we can't get them out. There is no system to be able to do this. So either the parents stay or the family stay to take care of them. And it's usually because they don't have the resources. And even if they were moving, the shelters right now, we're trying to equip them. We're looking at rehabilitation. We're looking at trying to be able to improve access. But this doesn't happen overnight. And therefore, this is a very vulnerable population. And I mentioned the psychiatric hospital. Well, the people who couldn't move were the elderly that were there. They've been in this hospital for decades. And they did not die directly from shelling. They weren't shot. Okay. But 5 or 6 weeks under those conditions, down in the basement with no water, no heat, very limited food, and you're already suffering. Well, that's what's happening right now in Kharkiv. That's what's happening in the Donbass. So, we're trying to get access. We're trying to find those local partners in occupied territories. And the good thing here is that we were there prior to the invasion. That was our base of operations. So, we're trying to get the word out to find who is operating, who's still able to move around. And the plan is to be able to get them supplies and equipment because they're not going to be able to procure. So if they're, let's say, running mobile medical units, we can perhaps find a way to resupply them with essential medicines because they can't procure. With the sanctions in place, with the supply chain mechanisms, this is something that we can help even in those occupied territories. And I think that is something to look at and think through here, where just because Russia is controlling an area, and we're hearing this report in Mariupol, yes, the final numbers of Ukrainian militaries have given up, they've left, but they're still Ukrainians in Mariupol. And the Russian administrators there are trying to take control, but there's a resistance that's taking place. So it's still active conflict. And after how many months of devastation to the infrastructure, we can't get in. The international community can't do what we're doing in Chernihiv. In Chernihiv, as I told you, that TB hospital, the referral hospital, our contractors and our technical advisors are telling us that we can have this thing back up and running in 3 months' time. 3 months' time, we're going to be able to bring back the second largest TB hospital in the former Soviet Union because we have access. But in those areas in the East, we don't have access.
Right.
So, and that's where that population, yes, they're the elderly, they are the disabled, they're the already, chronically impoverished population. And that's where we want to stay. And that's where, as we are scaling up, whether that's in Kyiv or Odessa, we're still going to be based in Dnipro, which is right in that little area in between the Donbass, in order to help with displacement, but be right next door so that when we find a local partner in the Donbass, we can support them in real time.
Okay. Well, I mean, we have just a minute or two left. I mean, is there any kind of final thought that you'd like to leave everybody with before we close?
I would just say that, I've been doing this for a while, and it's, no one conflict, no one emergency is the same. And when you sit down and you talk to people who are affected by this, you feel that. And I would say that what I would pass along is that what our teams, International Medical Corps, are doing is just incredible. So anything that you can do to send well wishes, to support them, it means a lot. And Oksana, who I met with in Bucha, one of the things she asked me is, does the world know what is happening here? Do they see this? And I think that as much as the financial resources are there for Ukrainians and for our IMC staff to know we're here to support you, that we're going to continue to be there, I think that goes a long way. So, I will just say that all of our staff globally at the International Medical Corps are doing an incredible job. Right now, the most acute emergency is Ukraine, and everybody from our global and our HQ are on the ground right now, and they're just doing a tremendous job. So I'm just, like I said, I'm so proud of what they're doing.
Right. Well, and then a key piece of that whole puzzle is certainly our donors and our supporters that are on the call today. And so just echoing Key's thanks and appreciation for your support, your trust, and your commitment to International Medical Corps. We're really happy that you were able to join us today. We look forward to staying in touch and keeping you up to date on how our response evolves. And we'll have another one of these sessions in the coming months. So thank you, Key, for joining us. And thank you, everyone, for joining the call today. Appreciate it. Thank you.
Thanks, everyone.